Hello guys, Vanakkam and welcome to Media Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and OET training. And in today's session, we are going to discuss about last minute exam preparation for JIPMER Nursing Officer exam. So already part 1 is there in the Media Nursing Academy YouTube channel. Very important vital golden points are there. Please watch the video and I will be giving the link in the description. Click on it and watch the part 1. And this is part 2. So each and every point whatever we have given with adequate explanation with rational. Please watch the video completely because all the point which we have added is already asked in the exam. Watch the video completely and utilize the knowledge. Let's begin the session. The first very important golden point is classification of mental retardation because many times they have asked question from here. What are all the questions they have asked so far? The first question they have asked is which mental retardation is educable? Among the 4 types of mental retardation, which mental retardation we can give the education? And the right answer here is mild mental retardation. The second question is, among these 4 classification of mental retardation, which one is trainable? For which mental retardation person we can give the training to lead the day-to-day activities? And the right answer is moderate mental retardation. So these two questions asked already in the exams. And also they will be asking, in case of mild mental retardation, what is the intelligent test value? And the right answer is 50 to 70. Moderate 35 to 50. Severe 20 to 35. Profound is less than 20. Okay, so these are all the 3 questions they are already asked in the exam. So what about the severe mental retardation? They are going to play the dependent life. Without the support of parents or the guardians, they cannot live their life. Okay, so they are going to play the dependent life. And profound means full support. For each and every minute thing what is needed, support is needed. Life support is needed. That is profound. Okay, so these are all the 4 types and intelligent test values of mental retardation. Very important, so focus on it. Okay, and the second thing is immunoglobulins. So till now in the exam, they have asked about IgG antibodies, IgE and IgA. Frequently they are asking the question from these 3 antibodies. So let's see the characteristics of each and every antibodies. This is also very important golden point. So first, IgG antibody. The characteristic is it is secreted by the plasma cells of the blood. What is plasma cells? It is also a type of WBC. Okay, and from the plasma cells, what is formed? IgG antibody is formed. And very important thing is it can cross the human placenta of the mother and it can reach the fetus. Very important point. They asked the question from here. Okay, and it is the most abundant type of antibody. Most abundant type of antibody. So this is the important point related to IgG. And the next one is IgE. It protects against the parasitic infection. The first golden point is it protects against parasitic infection. And this antibody level is always high in people with allergy. Very important point. Okay, and found mainly in lungs, skin, mucous membrane. Okay, so next one is IgM. The first antibody produced in the primary response of the antigen. This point is very important. This is the first antibody which is produced in the primary response of what? Antigen. Any infection is coming inside our body. The first antibody or immunoglobulin which is going to act against that particular infection, IgM. And the next important point is it is the first antibody produced by the fetus. And it is attached in the surface of the B cells, B lymphocytes. There are 2 types of lymphocytes, right? T lymphocytes and B lymphocytes. Okay, so this IgM is attached with the B lymphocytes. And next one, IgA. It is found in breast milk. This question also asked already. It is found in breast milk, mucosa, saliva, tears, and protects against pathogen. And the last immunoglobulin is IgD. The exact function is unknown. Exact function is unknown. Fine. So these are all the 5 important type of immunoglobulins. The characteristics are very, very important, guys. Okay. Fine. And the next one is we are going to see different type of scales. Okay. Let's see one by one. The first one is RAS. RASS. The full form, the abbreviation of RAS is Richmond Agitation and Sedation Scale. So it is used to assess the patient level of sedation in the intensive care unit. The person is having or infused with the sedation. I can use a RAS scale in order to find out the level of sedation in the intensive care unit. Okay, so the full form is Richmond Agitation and Sedation Scale. And the second one is CDR scale. CDR scale. The full form is Clinical Dementia Rating Scale. Dementia Rating Scale. You all know about what is dementia. Dementia, it is a gradually the disease condition, signs and symptoms will increase. Progressive increase in the signs and symptoms of the disease. Okay, and here loss of cognitive functions will be there. What are all those cognitive functions? Memory, thinking, concentration will be gradually lost from the patient. So this condition is called as what? Delirium. And how we can assess the delirium? By means of using a scale called as CDR scale. It is a numerical scale used to assess the severity of the symptoms in dementia. It is used to assess what? Severity of the symptoms. Okay, so this is all about the CDR scale. And the next one is very known scale for everyone. Hope everyone knows about this one. That is Borden scale, Norton scale and Waterloo scale. Borden, Norton and Waterloo scale. All these 3 scales are going to assess the pressure ulcer, otherwise decubitus ulcer. Okay, so Borden scale, it is used to yearly identification. Underline the keyword yearly identification of the patient at risk for forming the pressure ulcer. Here we are going to identify the yearly signs and symptoms for the development of pressure ulcer. The first one. The next one, Norton scale and Waterloo scale, which is used to assess the risk for pressure ulcer in adult patient. Okay, risk for pressure ulcer in adult patient. We are going to use what? Norton scale or Waterloo scale. Okay, and the next one is VIP score. This one is also very common. VIP score or VIP scale. The abbreviation is Visual Infusion Phlebitis Score. The person is having IV cannula. Okay, so when the cannula has to be removed, whether the person had phlebitis because of the insertion of the cannula. How we can identify? By means of using the Visual Infusion Phlebitis Score. You can identify the yearly signs and symptoms of phlebitis. Fine. So this is about the VIP scale. Next one, Boas scale. BOAS, Boas scale. The full form is Beck Oral Assessment Scale. It is used to assess the oral cavity. Beck Oral Assessment Scale used to assess what? Oral cavity. And the next one is FLAC scale. The full form of FLAC is Face, Leg Activity, Cry, Consolability Scale. It is mostly used for what? Children's in between the age of 2 months to 7 years. And for those who can't express their pain. Okay. See, this FLAC scale is the one used to assess the level of pain for the children in between 2 months to 7 years or for those who cannot express their pain. Okay, and the abbreviation of FLAC is Face, Leg Activity, Cry and Consolability. And the next one is P scale. The C is silent. P scale. So what is that? Clinical pulmonary infection score. CPIS means clinical pulmonary infection score, which is used as a screening tool in ventilator associated pneumonia. Okay, fine. And the next one is SOFA score. This is also very common. You would have been undergone this word. SOFA score. Sequential organ failure assessment score. SOFA, the full form is sequential organ failure assessment score. Fine. And the next is Buerger's disease. What is that? Buerger's disease. This Buerger's disease is also called as thromboangiitis obliterans. Usually this Buerger's disease is confused. The symptoms of Buerger's disease is confused with the Raynaud syndrome. Buerger's disease and Raynaud syndrome. Many students are confused because of the signs and symptoms are more or less similar. Here also the blood vessels are affected. Here also the blood vessels are affected. But there is some changes or difference in the signs and symptoms. Let's see about the Raynaud syndrome. In the Raynaud syndrome, because of once the person exposed to cold, the blood vessels are severely contracted. See, this much contraction is taking place. There is no blood supply to the fingers. So there is no blood supply to the fingers means the fingers is going to become white. You can see the white color change in the finger. Okay, white color is there. Okay, after that, because of lack of blood supply, because of continuous ischemia, underline the word continuous ischemia, the white color is going to become cyanosed, that is bluish discoloration is going to take place. Fine. After that, once the blood vessels become dilated, that time again there is a flushing of blood, backflow of blood again to the particular fingers. That time the skin is going to become red. So three classical manifestation I have explained here in the Raynaud syndrome. The first one is because of once the person exposed to cold, because of severe blood vessel contraction, the fingers is going to become white in color. After that, because of continuous ischemia, the fingers color is going to change. What color? Blue color. At last, because of the dilatation of the blood vessels, the backflow of blood is there again and the finger is becoming red in color. So white, blue and red. These three manifestations will be there in the Raynaud syndrome. Whereas in Buerger's disease, in Raynaud syndrome, contraction of the blood vessels, right? Whereas in Buerger's disease, inflammation and thrombosis will be there in the small and medium sized blood vessels. Inflammation and thrombosis. Because of thrombosis, blockage of the blood supply to the particular part of the fingers, it leads to ulcer and gangrene formation. Okay, there is a difference between contraction and blockage. Contraction means the blood vessels are contracting once they are exposed to the cold environment. After that, it is becoming dilated and adequate blood flow will be there. During contraction, less blood flow. After that, adequate blood flow is there. This is called as what? Raynaud syndrome. Whereas in Buerger's disease, there is an inflammation and blockage. Thrombus formation will be there. So the blood flow is totally blocked. It leads to what? You can see the ulcer formation and gangrene formation in these two images. Okay, you can see the fingers here, gangrened fingers. Here also ulcer is formed. You can see in this picture there is some blockage in the blood flow. Okay, so gangrene formation is there. So this is called as Buerger's disease, or it is also called as thromboangiitis obliterans. And the next one is very commonly asked question is basilar skull fracture manifestations. The base of the skull there is a fracture. Underline the word, in the base of the skull there is a fracture. So what are all the manifestation you can see from the patient? The first and foremost thing is raccoon eye. You can see the ecchymosis here. Why? Why it is called as raccoon eye? Raccoon is the name of this animal. See the eye of the animal. It is dark in color, right? Same way, the human beings, if the person is undergoing basilar skull fracture, ecchymosis will be present around the eye. Around the eye. That's why it is called as what? Raccoon eye. Followed by that, hemotympanum. If you see the tympanic membrane, what is the normal color of tympanic membrane? It will be pink in color. Okay, because of adequate blood supply. Whereas in case of basilar skull fracture, you can see hemotympanum, dark erythematous tympanic membrane. The next one is battle sign. In the mastoid bone, ecchymosis is there. This is called as battle sign. Just behind the ear, mastoid bone is present. There ecchymosis, redness will be there. And the next one is halo sign. Very important sign. Halo sign. If the person is lying over the pillow, you can see the dark red color discoloration in the center, and the CSF will be accumulated in the surrounding area. Surrounding CSF in the center, what will be present? Blood will be present. This sign is called as what? Halo sign. So these are all the common manifestation of basilar skull fracture. Very important, many times they have asked this question. And the next thing is bulimia nervosa. If you come across the word bulimia nervosa, immediately you have to think about two things. The first one is binge eating and second one is purging. What is binge eating? The person is having a craving to eat more and more amount of food, and they will eat more and more amount of food. After eating that, they cannot tolerate the more amount of food entered inside the body, and they will purposefully induce the vomiting. That is called as what? Purging. Voluntarily they will insert the finger, then they will induce vomiting. That is called as what? Purging. Okay, so when you come across the word bulimia nervosa, you have to think about two things. The first one is binge eating and second one is purging, that is self-induced vomiting. And the second very important point related to bulimia nervosa is chipmunk face. What is this chipmunk face? See, because of continuous binge eating and induced vomiting, what will happen? The parotid gland is going to get enlarged. Parotid gland, which is present on both the sides of the mastoid bone, it is going to get enlarged. So swelling of the parotid gland will be there. Okay, so this swelling, for example, this is the normal face, means this is the eyes. Okay, this is the normal face, means what will happen in case of chipmunk face? There will be some enlargement. You can see here, this is the normal face. It will be like this. Okay, and in case of chipmunk face, there will be a swelling in the parotid gland. This is the parotid gland. Okay, there will be swelling. Why? Because of continuous eating and inflammation is taking place in the parotid gland enlargement because of induced self-vomiting also. And you can see for this patient, the knuckles, the fingers, knuckles, there will be some changes, color changes. Because continuously they are inserting the finger inside the mouth and the finger knuckles will be getting injured because from the teeth of the patient. So some discoloration, color changes will be there in the knuckles of the fingers. Okay, so these are all the manifestations of bulimia nervosa. And the next very important thing, very common one is chickenpox, which is caused by varicella zoster, as you all know that. Here, which is the very common question till now they have asked is, which is the causative organism? Varicella zoster. And second one is, what type of rash will be present to the patient? This question is asked many times in the exam. What type of rash will be present? What is the name of the rash? That is phleomorphism. All different types of rashes will be present to the patient. Okay, so what are all those different types of rashes? Macules, papules, vesicles, crust formation, pink protruded papules will be seen, okay, in the chicken pox. So all different types of rashes will be present in the same time. This condition is called as what? Pleomorphism. These rashes, all different stages of rashes is present in the same time, means that is called as pleomorphism. Okay, and the next question what they asked commonly is, in chicken pox, which part of the body the first rashes will be appear? And here the right answer is in the trunk. That is, the rashes first appear in the chest, back and face. So these points has to be remembered. And the next one is cholera. You all know about cholera. Cholera means immediately you have to think about what? Rice watery stool and washerwoman's hand. Why there is a washerwoman's hand? Because of continuous dehydration, wrinkled hand will be seen. Because of dehydration, the hand is going to get wrinkled. So that hand is called as what? Washerwoman's hand. Another one is rice watery stool. So these are all the two classical manifestations of cholera. Next one is cirrhosis of liver. So you all know what is meant by cirrhosis of liver. See, consider this is the liver and there are many blood vessels which is present in the liver. Okay, so these are all the normal blood vessels and this is the normal liver. Suppose the liver is cirrhosed. The liver is cirrhosed. This is the cirrhosed liver. The blood vessels whatever present within the liver is going to get squeezed, crushed, compressed. So what will happen? Whatever the blood which is present in the blood vessels, n number of blood vessels are present within the liver. You understand that? Okay. So whatever the blood which is present within the blood vessel, it is going to squeezed out. Squeezed out. Okay. Take a tube. Okay. Water is there in the tube. If you are pressing the tube here, what will happen? The water will go out forcefully, right? The same mechanism you can apply here also. Because of compression, cirrhosis of the liver, what will happen? Whatever the blood which is present within the blood vessels of the liver, it is going to pump out very forcefully. So it leads to what? The first complication of cirrhosis of liver is ascites. Okay, and second one is esophageal varices. Third one is caput medusae. Fourth one is spider angioma or spider nevi. Fine. So esophageal varices will be there because forceful pumping of the blood to the all parts of the body. You can see the severe dilatation because of forceful pumping. The blood is moving very fastly out of the liver and it is going to all over the body. So the blood vessels are totally dilated. Okay. Inside the liver, the blood vessels are contracted. Outside the liver, all the blood vessels are dilated because of the force which is caused by the cirrhosed liver. Okay, so you can see the caput medusa, dilated blood vessels here. Ascites will be there here. Spider angioma will be there. Hemorrhoids will be there. What is that? Hemorrhoids. Hemorrhoid is also a dilatation of blood vessels. Right? So these are all the classical manifestation or the complication of what? Cirrhosis of liver because of forceful, pressureful extraction of the blood. Portal hypertension will be there. What will be there? Portal hypertension will also be there. Okay. So next very important and classical manifestation of cirrhosis of liver is athetosis. What is athetosis? See, the protein, it is metabolized and it is transformed or converted into amino acid. And this amino acid is further converted into ammonia. These are all the metabolic process I am telling. Okay, ammonia. And this ammonia should go to the liver, and it will form uric acid. Okay, this is the normal mechanism of protein metabolism. Okay, but here in cirrhosis of liver, what will happen? The liver is cirrhosed, the liver is not doing its function properly. So the ammonia, the product, the third end product of protein, ammonia, cannot enter inside the liver and it cannot convert it into urea. So what will happen? Ammonia is going to accumulate in the blood, and this ammonia is going to cross the blood brain barrier and it reach the brain, and in the brain it will cause what? Hepatic encephalopathy. During hepatic encephalopathy, what is the classical manifestation of hepatic encephalopathy? Asterixis. If you are flexing the hand in this side, dorsiflexion, if you are doing the dorsiflexion, automatically, dorsiflexion means like in the traffic police they will do please stop, right? They will be lifting the hand and showing stop, right? The same way the physician will make the patient to lift the hand. While lifting the hand, automatically dropping of the hand will take place. Okay, so this is called as what? Asterixis. It is because of damage of the nerves caused by the ammonia accumulation in the brain. That condition is called as hepatic encephalopathy. Fine. And the next one is Guillain-Barré syndrome. See, Guillain-Barré syndrome, immediately you have to think about what? Ascending weakness, ascending muscle paralysis. Okay, and the next important point related to Guillain-Barré syndrome is Campylobacter jejuni. There are many causative organisms or many causative factors, autoimmune disorders which is related to Guillain-Barré syndrome. But the main cause for Guillain-Barré syndrome is Campylobacter jejuni. Our body will produce the antibodies against the Campylobacter jejuni. At the same time, it will damage the peripheral nervous system also. Antibodies which is formed against the Campylobacter jejuni, it is going to damage the peripheral sensory nerves also. Okay, and the complication here is respiratory failure. See, ascending muscle paralysis will be there. First, the leg is going to get paralyzed. After that, the hand is going to paralyze. After that, the trunk is going to paralyze. Okay, so in the trunk, in the chest, what is present? Lungs are present. Okay, so respiratory muscles are going to get paralyzed, means respiratory failure will take place. Fine, always the ventilator has to be kept for the in case of any life-threatening situation. Fine. So Campylobacter jejuni and ascending muscle weakness, these two points is very important point in the Guillain-Barré syndrome. The next very important point is Herring-Buer's reflex. Herring-Buer's reflex. See, two type of action is taking place in the lungs. The one is inspiration and second one is expiration. Inspiration, what will happen? The lungs is going to get dilate because the alveoli is going to get dilate, bronchi, bronchioles, small branches of the lungs is going to get dilate. So the lungs is also going to get dilate. Fine. So this is the lungs. And you can see the bronchi and bronchioles here, trachea here. Once the person is taking inspiration, immediately the bronchi, bronchioles, trachea, everything is going to get dilate. One sec. Yes. So what I want to say here is, after a particular point of dilatation, the lungs has to stop the dilatation, right? Otherwise, if the lung is keep on dilating, what will happen? Rupture of the alveoli will take place. At one particular point, the lungs dilatation, the alveoli dilatation or the bronchioles dilatation has to be stopped, right? During inspiration, at particular point, the dilatation of the bronchi, bronchioles, lungs, alveoli, everything has to get stopped. How it is happening? Who is stopping the dilatation of the lungs? That is the stretch receptors which is present on the bronchi and bronchioles. It is the one stopping the dilatation of the lungs alveoli. Okay, so this stretch receptor, which is present on the walls of the bronchi and bronchioles, it prevents the over expansion of the lungs and prevent the degree of inspiration. Only this much the inspiration should take place. This much the expansion of the lung should take place. Okay, so that mechanism is done by the stretch receptors which is there in the bronchi and bronchioles, and this reflex is called as what? Hearing Buer's reflex. In the exam, 2 questions already they have asked related to the hearing Buer's reflex. What is that? You can see here. The first one is receptor in the inflation reflex are central chemoreceptor, peripheral chemoreceptor, aortic baroreceptor, stretch receptors in the walls of the bronchi and bronchioles. The question is receptors in the inflation, hearing Buer's reflex. Hearing Buer's reflex, which receptors are present? Stretch receptors are present. So option D is the right one. Option D is the right one. And where it is present? It is present in the walls of the bronchi and bronchioles. And the next question is output of inflation of hearing Buer's reflex. Once the hearing Buer's reflex is activated, what will happen? What is the output? The inspiration is stopped. The inspiration is stopped. If the inspiration is stopped means what is the next mechanism will start? Expiration will start. The inspiration stop, expiration will start. Okay. So what are all the options given here? Prolonged inspiration. No, this is not the right answer because the inspiration is going to get stopped. Increased respiratory depth. No. Expiration. Okay. And the fourth option is increased blood pressure. Wrong. So which is the right answer? Option C is the right one because inspiration is going to get stopped and the expiration is going to get start. That is the output of hearing Buer's reflex. Output of hearing Buer's reflex is expiration is going to get stopped. Okay. The next very important commonly asked question is during depression which enzyme level is going to get decreased? And here the right answer is serotonin. But in a recent exam they asked the same question, but in that question the serotonin option is not there. And the student got confused because which option was there? 5-hydroxyindoloacetic acid, this option was there, but serotonin option was not there. So many students made the mistake. So what is 5-hydroxyindoloacetic acid? See, the metabolic product of serotonin is nothing but 5-hydroxyindoloacetic acid. It is the end product of serotonin. So during depression, the serotonin level is decreased means 5-hydroxyindoloacetic acid, HIAA, that level is also going to get decreased. Okay, so you have to search for either serotonin. If serotonin option is not there, you have to search for 5-hydroxyindoloacetic acid. Fine. So both the level is going to get decreased in case of depression. And the next question is Gover sign. See, they will be giving the image like this and they will ask what sign is this. See, here the person wants to stand. From sitting, the person wants to stand. And the person is having proximal muscle weakness. So this kind of characteristics will be there while the person is standing. From the sitting position, he wants to stand means they are going to use both the hands for the support and they will stand up. This is called as proximal muscle weakness, and this Gover sign is seen in disease called as Duchenne muscle atrophy. Fine, very important point, guys. And the next one what you are going to see is athetosis. What is athetosis? If there is damage at the level of basal ganglia, very important point. If there is any problem or damage at the level of basal ganglia, you can see slow involuntary snake-like movement. Underline this word, this point is very important. Snake-like movement is seen on the fingers, face, neck, upper extremities. Because of damage of what? Basal ganglia, a slow involuntary snake-like movement. You can see like this. Okay, snake like movement. Okay, it is seen in the fingers, face, upper extremities or neck. Okay, so that condition is called as what? Athetosis. Okay, this is image based question. They will be giving the image like this and they will ask what type of movement is this, and you can say snake like movement. Otherwise they will ask in which disease condition these characteristics will be there, this snake like movement will be there, and you have to say athetosis is the right answer. The next very important point what we are going to discuss is Brodmann's area. Guys, our brain is having different parts and each parts is given with some numbers, and that number is called as Brodmann's number or Brodmann area because it is invented by or introduced by Brodmann. So totally how many Brodmann's area you can see in this image? There are many numbers given here, right? Many numbers are there all around the brain. So this is called as Brodmann's area. Total 1 to 52. Total how many numbers are there? 52 numbers they have given to the brain. 52 Brodmann's area is there in the brain. Let's see some of the important areas which can be expected in the exams. The first one is bronchos area. What is the Brodmann area number for bronchos area? 44 and 45. You can see 44 and 45 is the Brodmann area number for bronchos area. Okay, what about for Wernicke's area? What is the number given for Wernicke's area? You can see here 22. 22 is the number given for Wernicke's area. What about auditory? This is the auditory area, right? And what number is given here? 41 and 42. 41 and 42 is the number for auditory area. Vision, for vision what number they have given here? 17. In order to maintain the pressure in the eardrum, what area is there? 43. 43 is given here. Okay, this one 43. Okay, so this is the memory based question. You have to remember these areas. Brodmann's areas, total 52. In case of bronchos area, it is 44, 45. Wernicke's area 22. Auditory Brodmann area 41, 42. Vision area 17. Pressure of the eardrum 43. Very important point, guys. Okay, and we have discussed about bronchos area and Wernicke's area, right? So for many questions asked related to bronchos and Wernicke's area, let's see those questions in detail. Fine. Bronchos area. This bronchos area, it is also called as what? Motor speech area. So what are all the golden points you are supposed to remember related to bronchos area? The first one is, it is also called as motor speech area. Motor means movement of the jaw, tongue. It is totally controlled by the bronchos area. Without this movement, the person cannot express whatever they want to speak. It cannot be possible if this motor area is affected. Okay, fine. So where this bronchos area is present, the second important point is it is present in the left cerebral hemisphere of the frontal region. In the base of the frontal region, in the left side, what is present? Bronchos area is present. Okay, and it is also called as I mentioned already, it is a language motor center. And the last point, very important point, is damage to this area will cause expressive aphasia. In the beginning I said that if the person wants to express something, movement of jaw should be there, right? So if the bronchos area is affected, the movement is going to get affected. So whatever the person wants to express, that expression is going to get affected here. So it is called as what? Expressive aphasia. If there is any damage to the bronchos area, what will happen? Expressive aphasia will be there. It is also called as bronchos aphasia. Okay, so here impaired speaking will be there. For example, the person wants to say, I want to take the cup. This is what the person wants to say. But while expressing, the person will say like this, I want cup. This is what they will say. Okay, see, actually the person wants to say that I want to take the cup. This is how the person wants to say, but he cannot say like that. He will say, want, take, cup. There is some grammatical problem. The person cannot express the full sentence properly. This is called as impaired speaking. The fluency, very important point, the fluency will be absent in the bronchos area. What will be absent in the bronchos area? The fluent will be absent. Okay. On the other hand, Wernicke's area is there. Wernicke's area is used for what? Language comprehension, understanding the language. If someone is speaking something, for example, I am explaining everything to you in this video, you are having the good Wernicke's area. That's why you are understanding everything. This is called as what? Wernicke's area. Okay. So Wernicke's area is also called as language comprehension center. Language comprehension center. It is present here. It is also present in the left side. Okay, fine. In the near to the temporal region. In the temporal region, what is present? Wernicke's area is present. Near to the auditory area, what is present? Wernicke's area is present. And if this area is damaged, receptive aphasia will be there. Receptive aphasia is also called as Wernicke's aphasia. Receptive aphasia is also called as what? Wernicke's aphasia. See, here fluency will be present for the person. The person will be fluently talking something. Whatever is they want to express, they are expressing. But you cannot understand what they are expressing. There will be neologism. New words will be present while they are speaking. Okay, because proper here you will see that there is in bronchos area there is problem with the fluency, but here fluency will be present, but you cannot understand what they are speaking. Different words they will use, and there is no meaning for the words, because what is affected here? The language comprehensive center is affected here. Understand? So the main difference between the bronchos area and Wernicke's area is, in bronchos area what aphasia is present? Expressive aphasia is present, and in Wernicke's area receptive aphasia is present. Okay, here you can see bronchos area, it is non-fluent. Just now I told fluency is affected, whereas in Wernicke's area fluency is present. Okay, and bronchos area it is responsible for motor movement. Wernicke's area it is responsible for sensory understanding. Where the bronchos area is present, it is present in the base of the frontal lobe, and whereas Wernicke's area it is present in the temporal lobe. Here in bronchos area the speech is slow and broken. Here the speech is normal, expressive, but makes little sense. There is no sense at all. Here broken words are present. Here word salad, there is neologism, new words they will make, and you cannot understand what they are speaking. So all these points you supposed to remember in case of bronchos area and Wernicke's area. Fine guys. So these are all the points, golden points, which is related to your exams. So all the best for your exams. So what I want to say is, I used to say rational and revision. Before exam, at least 3 times revision you supposed to do. Hope everyone would have done that and understand the rationale, so that it will be easy for you to solve the question very fast. Solving the question very fast, understanding the question fast is very important because of lack of timing. So all the best for your exams. Don't worry about your results. You have to do more hard work. If you have done more hard work, surely your result is going to be positive only. Okay, fine. So thank you very much for watching the video. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Share the video with everyone so that everyone will get utilized from this. If you have any comments, if you want to add more points, any suggestions, any corrections, you can tell us through the comments, which is there in the comment box. Okay guys, so thank you very much and all the best for your upcoming exams. Thank you.